Hello everyone, this is Marika and I welcome you all to this new session of Nursing Management with me. So in our previous sessions, we have discussed about patient classification system and we have seen what are the different types of patient classification system and how are patients classified into different groups. In this session today, we are going to see what is a nursing care delivery system. We are going to see the purposes, the principles and the characteristics of nursing care delivery system. What do we understand when I say nursing care delivery system? Nursing care is rendered to each and every patient, and nursing care differs from one patient to another patient. Nursing care depends on the need of the patient, and there are various methods of nursing care delivery system. The function of the nurse is not just providing care to the patient, but to understand the needs of each and every individual patient and also to organize the task that is to be carried out for each and every patient with different healthcare needs. One of the major responsibility of a professional nurse is to be able to organize the tasks to be carried out to meet the individual healthcare needs of different patients within the unit as well as within the organization. In order to make sure that all the activities are carried out properly and that the nursing care is rendered properly, there should be a coordination between the works to be performed or the activities to be performed, the workers who are there to perform the task, and also the skills of each and every worker. Since the World War II, the nursing care delivery system has undergone continuous changes. Over the years, as the health needs of the patient changes, as the healthcare delivery system changes, there are various different nursing care delivery systems that have been criticized. Over a period of time, there have been debate to prove that different method of nursing care delivery system is effective. But we have to understand that no nursing care delivery system is perfect. There are different methods of delivering the nursing care to the patient, but we cannot say that a particular method that is chosen is a perfect method to meet the healthcare needs. Therefore, many of the different organization uses the combination of different methods according to the changing needs of the patient. As a hospital is an organization, different organization to meet the unique needs of the patients that are available in the hospital, they modify the different methods that I use, they combine the different methods that I use, and therefore they use a unique method to meet the health needs of the patient. One of the major challenges that is faced by the nursing profession as a whole is the way in which nursing care is being delivered to the patient. As we know that in a particular unit as well, there will be different patients with different healthcare needs. And so to meet the individual health needs of the patient is really difficult. So the kind of nursing care delivery system plays a major role to meet the healthcare needs of the patient. Moving on, let us see what are the purposes of nursing care delivery system, which means why is it necessary for us as nurses to understand what kind of nursing care delivery system to be used. Now, there are several purposes. The very first purpose is to delegate the work or the responsibilities to all the nursing personnel employed in a particular unit in order to make sure that the responsibilities are assigned properly to all the nursing professionals. Nursing care delivery system must be used. The line of authority, the job description, and the responsibilities to be carried out by nursing professional will be clarified with the use of nursing care delivery system. The second main important purpose of this is to make sure that there is a cooperation and coordination between the nurses working within a particular unit. As the nurses choose a particular method of nursing care delivery system, the roles and responsibilities, the job description is clarified for each of the nursing employees, and therefore they accept the work that they are supposed to do, and they also understand the responsibilities and the job that is to be carried out by other people, and therefore this helps to gain cooperation and coordination between the team members. The third purpose is to define the responsibility of each of the staff members. So in nursing care delivery system, when a particular method is selected, as I told, the roles and responsibilities and the job description is clarified to them, and so it helps to define the responsibilities of each and every staff member. Another important purpose is to provide teaching for all the staff nurses as well as nursing students. As I told, this helps to clarify the responsibilities and the job description, and therefore it also helps to identify the staff that requires training in order to perform those tasks. Another important purpose of selecting a particular nursing care delivery system is to prevent the overlapping of the nursing functions. Now, many a times when a proper method is not clarified, people do not know what are the responsibilities that are to be carried out, and therefore the same task can be carried out by different nurses for the particular patient. Choosing a particular nursing care delivery system will help to prevent the overlapping of the nursing functions, because different functions are given to different nurses and it is assigned to a particular nurse, and therefore this will help to prevent the overlapping of the tasks that are to be carried out. The next purpose of selecting a nursing care delivery system is to increase the skill of the nurses. As I told, here the responsibilities, the job descriptions are clarified, and also there will be identification of the nurses that needs to be trained appropriately. And because the nurses are also supposed to carry out the task that is given to them, as they perform it over a period of time, as they also get the supervision and training from the staff members, it helps to increase their skills. Another important purpose is that it facilitates the accountability. We already are aware that the job is clarified for each and every staff, and therefore they are themselves accountable for the particular task that is assigned to them. Next responsibility is the fair distribution of the workload, responsibilities and the activities among the staff members. So here there is no chance of some of the employees carrying out majority of tasks and some of the employees not carrying out any task. Here there will be equal distribution of the tasks that are to be carried out by each and every staff working within the unit to meet the goal of patient satisfaction. Another important purpose is to provide safe and quality comprehensive nursing care for all the different patients within the hospital. Moving on, let us now discuss the criteria for selecting the appropriate method of nursing care delivery. So as I told, there are different types of nursing care delivery and different methods are used in different hospitals, and sometimes they even combine different methods in order to meet the unique health needs of the patient. Now, as there are different methods, there are certain criteria to be used while we select the appropriate method of nursing care delivery. Let us see what are those. The very first criteria that is taken into consideration is the skill and expertise of the staff. So here the skill of the staff, the expertise of the staff play a major role in order to decide what method of nursing care delivery will be appropriate. As we know, there are different methods, and in different methods the responsibilities that are divided will be different. The kind of work that is to be carried out will be different, and therefore the skill of each and every staff working within the unit to meet the healthcare needs of the patient plays a major role. So the very first criteria to take into consideration before we select the appropriate method is to see the expertise and the skill of each of the employees in the organization. The second important criteria is to also check the availability of all the nursing professionals within the organization. So it is necessary for us to not just see what are the tasks to be performed, but also to make sure that there are enough number of staff to perform those tasks. So the availability of the nursing staffs within the organization is also one of the major criteria. Another important criteria is to see the economic resources of the organization. We know how much economic resources are important, so we also have to see the economic resources of the hospital before a particular method of nursing care delivery is actually adopted. The next important criteria is to make sure that we know the complexity of the task that is to be performed. We know that in nursing there are different tasks that are performed, and we have very simple tasks such as cutting the nail of the patient or providing nail care, to a very complex task that is to be performed by a nursing professional. We have to understand that as the complexity of the task increases, the kind of skill that is required by the nurses in order to complete the task is also high. So the complexity of the task is also one of the major criteria that we have to keep in mind before we select a particular or an appropriate method of nursing care delivery. So these are the various criteria that are to be followed before we select an appropriate method. Moving on, let us see what are the principles of personal assignment. So when we are assigning a particular patient or a group of patients to the nurse, or when we are assigning any kind of task to a professional nurse, what are the various principles that are to be followed? The first line manager, or the person who manages the nurses immediately, who supervises the nursing care immediately, will be the people who will decide what will be the most appropriate way of delivering the nursing care. So it should always be made by the first line manager, which is either a head nurse or a nurse in charge. And they will select the appropriate method of care delivery based on various different things. The first one includes the nursing needs of the patient and the amount of time that the nurse has to invest to take care of the patient. The second one is the capability, skill, and expertise of each of the staff members working to meet those needs of the patient. And the third one is according to job description, or based on job descriptions. So the nurses who acts as a first line manager, such as staff nurse or a head nurse, will be the person who will make the decision of selecting the proper or appropriate nursing care delivery system, and it is based on three different things, which includes the job description, the health needs of the patient, and the time that the nurse has to invest in order to meet those needs of the patient, as well as the skill that is required by the nurse to meet those needs. The second principle says that the nursing care delivery system should not change on day-to-day basis, but it must be planned for a period of week to ensure the continuity of the care. So obviously, if different methods are used on a day-to-day basis in order to meet the health needs of the patient, it will not ensure a continuity of care. There can be fragmentation in the care that is provided to the patient. Therefore, it must be planned for a period of week rather than planning it on a day-to-day basis. The third important principle is to take into consideration all different kind of activities that are to be performed within the ward in order to maintain the particular ward. Not only including the task that is performed directly, there can be certain small tasks that are to be performed for the smooth functioning of the unit. So whenever personal assignment is done, we should make sure that all those activities, even the minute activities to be carried out in the ward, is taken into consideration. The fourth important principle is to consider the geographical location of the unit. We have already seen that the smooth functioning of the particular hospital, of the particular unit, also depends a lot on the geographical location. In order to reduce the workload on the staff, in order to reduce the effort that is to be put by the nurses, the geographical location of the unit is also to be taken into consideration while personal assignment is planned. The next important principle to be kept on mind is to maintain a balance among the staff nurses, or all the staff nurses. So if there is a particular unit and if there is a task to be assigned, it must be made sure that each and every staff or each and every individual within the organization are carrying out the equal number of tasks and they are putting in equal effort for the management of the ward. The next important principle says that we should never assign the same task to more than one nurses. So obviously, in order to reduce the duplication of work, in order to make sure that the work is appropriately divided and it is not done again and again, in order to eliminate the error, we should make sure that we do not assign the same task to more than one nurse. So these are the several principles that are followed while personal assignment. And this brings us to the end of today's session. In this session today, we have discussed about nursing care delivery system, where we have seen what are the different purposes of nursing care delivery system, what are the criteria that are followed to select the appropriate method, and also the principles for personal assignment. I hope the class was helpful and I'll see you all in the next session. Thank you and have a great day ahead.